Welcome to the NICUToday Podcast, a podcast to give families a new point of support as they navigate the NICU journey. Thank you for listening. Please don't forget to subscribe wherever you enjoy your podcast and share this episode with anyone who might find it helpful. Welcome back to the NICUToday Podcast. Dr. Thiviya Selvanathan is a neonatal neurologist and clinician scientist at BC Children's Hospital and the University of British Columbia in Vancouver, Canada. Dr. Selvanathan's research uses advanced brain imaging techniques to understand how early life brain injury and NICU clinical care impact brain development and neurodevelopmental outcomes in preterm infants. This is incredible work that you're doing. Thank you so much for being here.
Thank you so much for inviting me. I'm really excited to be here and for us to have a nice conversation.
Oh my goodness, this hits home. I know you and I spoke before. This really hits home for our family, just what we went through in the NICU. But Dr. Selvanathan, tell us about your background. What led you down this career path?
Sure. So I'm a pediatric neurologist, and I completed specialized training in neonatal neurology or newborn neurology. So what that means is I spend most of my time as a neurologist in the NICU, seeing babies who have brain injury or babies who have neurologic disorders. But one thing that's really special about what I get to do is I get to see babies and families in the NICU and then follow them over time as they get older. And this is something that I especially love and drew me towards neonatal neurology in particular. I'm also a clinician scientist, so that means I spend a lot of my time doing research in the lab. And what I realized as a trainee early on, as a pediatric neurology resident, is that neonatal neurology is a relatively new area within neurology, and we're only beginning to understand more about how resilient the newborn brain is. And this drew me to a more research-focused career to try to find answers to the many questions that clinicians in the NICU and also parents and families ask us about neonatal brain injury and neurodevelopment, because we're only beginning to understand the newborn brain. And this is why I love doing research and trying to find answers to some of those questions.
Well, and I can only imagine the miracles that you followed from being born prematurely, spending time in the NICU, to what you are seeing now as you get to watch these children grow too, right?
Yeah, exactly. It's the part of my job that I love the most. Being in clinic is so nice. It's so nice to see children get older. It's so nice to talk about, what they love to do, like what's their favorite thing about school or what they're doing over the summer, and see how they grow and develop. And that's something that's really special.
That's incredible. Well, tell us about some of the research that you're currently doing around brain development and brain injury, and especially when you look at babies born prematurely.
Sure. So our research is very much focused around questions that clinicians in the NICU and families in the NICU ask us. So a very important question that we're asked by families in the NICU as a neurologist is, how does brain injury impact my baby's development? And as a neurologist, we see a lot of variability in how kids do after neonatal brain injury. And many of the times, we say, maybe there will be some concerns with your child's development, but it's challenging for us to be very specific around what to expect for a baby's future. And that can be very frustrating for a lot of families. So a lot of our work, a lot of our research is focused on identifying better predictors or more accurate predictors of neurodevelopmental outcomes, specifically using brain MRI. And another important piece is understanding how brain injury impacts brain development in the NICU, because the baby brain, the preterm brain, is still immature. It's still growing and developing, and has this ability to, form new connections, strengthen others, and that's what we refer to as plasticity. So understanding that can give us more answers potentially around how to better predict neurodevelopmental outcomes for babies who have brain injury. And this is so important because it allows us to give families more information. We can also identify the highest risk infants early while they're in the NICU, which means we can start interventions earlier as well while babies are in the NICU. I think it's also really important for us to know when we expect there to be no impact on a baby's development so that we can reassure families and say, I don't think this is going to impact your baby's development. So that's what a lot of our work around brain injury has focused on. The other important piece is identifying factors both in NICU care and beyond NICU care that can modify neurodevelopmental outcomes. In the past, there was this thinking that, okay, a baby had brain injury, this is their outcome. But we now know that outcomes after neonatal brain injury are not fixed, they're modifiable. And if we can find ways through which we can modify outcomes, that allows us to develop new strategies to promote neurodevelopment and brain health in these babies. So that's another aspect of the work that I'm doing in the lab.
Well, and I feel like this research that you're doing has to be so comforting for families looking ahead. I mean, I think back on our NICU journey, our daughters were born, our surviving twin, Claire, was diagnosed with grades 3 and 4 brain bleeds, one on either side, day 3 of life. Basically, we were told she had high probability of not walking or talking if she survived. Definitely some type of deficit is written in our journal that we kept in the NICU. But I do think it's so unknown because if you met Claire today, you'd never know she was a 15-ounce, 23-weeker, right? She has a beautiful voice. She just had a lead in her middle school musical. She sang at our Miracle Ball. I mean, you would never know that, but we didn't know what her outcome was going to look like. And so I feel like so many parents don't, and even any type of guidance that helps to prepare parents a little bit more through this research that you're doing it's incredible.
Thank you. Yeah, I think it's very much the questions that families are asking us in the NICU, and they want more information. And unfortunately, what we have is it isn't perfect. So we're hoping to find better ways to give families more information they need.
Now, I did want to ask you about pain and the impact of pain on a baby's brain. You and I had talked about this a little bit, and what comes to mind for me is, to this day, Claire's almost 15 years old. When she walks, she still has these little bumps on her heels that I see from the heel pricks that she got every day. And, obviously she has scars or battle wounds on her arms from all the needles in her arms. But how does that go into your research that you're doing?
Yeah, so that's such an important part of what we do. So a lot of our research here in British Columbia at UBC is focused on early life pain exposure and how that impacts the baby brain, specifically in preterm infants. So we know that early life experiences shape how the brain develops. And the preterm brain is still very immature and is undergoing a lot of development while babies are in the NICU with us. These early life experiences include things like painful exposures and experience to pain. And what we have learned from now many studies that we've done across cohorts here in British Columbia, but also around the world, is that the more painful experiences preterm baby experiences, the more impact it has on their brain development and their neurodevelopmental outcomes. And so what that tells us is, although unfortunately pain is a part of life-saving care in the NICU, it is a modifiable factor and one that we need to pay more attention to, specifically around thinking about how we can reduce painful exposures as much as possible to protect the developing brain. So that's a big focus of our work here in British Columbia, in the NICU, both clinically and from a research perspective, thinking about how we can reduce pain exposures and how we can best treat pain in babies as well to protect the brain.
So my mind is blown here, all of this research that you're doing. It's so it's just it's so meaningful as a parent who really literally went through this with their children. And I did want to ask you, I shared a little bit about Claire's diagnosis, day 3 of life. I still remember just bawling my eyes out walking down the hospital hallway. Our daughter Mary was still with us. She had not passed away yet. She had been diagnosed with a grade 2 bleed. But when you're meeting with families when you're in the NICU and you're meeting with families and you see their diagnosis, what what do you tell parents they should expect? I mean, how do you walk them through those brain injuries?
Yeah, that's a great question, and one that's difficult to answer because it depends on so many things, like, what the type of brain injury is, what the severity of the injury is, where the brain injury is. So I usually start off with just reviewing that with the family. Some families find it really helpful to look at their baby's brain MRI, so we'll go through that together. Um, but overall, I think what's very important is recognizing that neurodevelopmental outcomes after brain injury are not fixed, but are modifiable. And that the baby brain is very resilient and that it's still developing and it's forming these new connections and new pathways. And that's what we talk about when we refer to brain plasticity. And that's our goal, to promote brain plasticity and to try to optimize that through providing early interventions. So a lot of what we talk about in the NICU is yes, focused on what the brain injury looks like, where it is, and so on, and maybe what we can expect in terms of outcomes, but also emphasizing that there's a range of outcomes that we see, and that our goal and our hope is to optimize brain development and neurodevelopment as much as possible through providing early interventions both in the NICU and after the baby leaves the NICU.
Not fixed, but modifiable. That
Yeah.
is the key phrase there, and definitely so true. What are the most frequently asked questions that you get? I know we talked a little bit about it earlier, but what are some of the other questions that you get from families?
Yeah. So I think another key question that families ask is, what can I do to support my baby's development? Like, that is one that I hear from every family I see in the NICU and outside of the NICU in clinic as well. And so we spend a lot of time reviewing strategies that families can do. Some of those will differ over time depending on the age of their child. But generally in the NICU, we emphasize as much skin to skin as possible, reading to their babies, singing lots of tummy time if they're able to do tummy time. And then we also, if we do have a baby who has brain injury, we also have our therapists come into the NICU and teach the family some strategies around how to support their baby's development while the baby is still in the NICU. And they're connected to infant development specialists after they leave the NICU, who continue to follow the baby and help provide the family with strategies around supporting development. So I would say that's the question I get asked by every family I meet. How can I support my child's development? And there are many nice ways that we can do that both in the NICU and at home.
Well, and what you bring up in those post NICU, the early intervention that you were mentioning too. I mean, just the importance of that early intervention piece when families graduate from the NICU. How significant is that? Getting
Oh,
them involved early.
yeah, that is so important. So I'm really fortunate. I work in a province where we have excellent neurodevelopmental services. So every baby who is in the NICU gets connected to an infant development specialist when they leave the NICU. So someone who will touch base with them, and this is someone who is closer to their home, so is in their local community, well aware of what services are available locally for the family as well. And this person's a touch point, someone for the family to touch base with about their child's development. And I think that's so important. One, for identifying concerns if there are any early, but two, also just reassurance, like, yes, you're doing all of these things, like your baby's doing really well. Like, that's also just as important. And then the other piece is, in British Columbia, we have a province-wide screening program for cerebral palsy to try to make a diagnosis of cerebral palsy as early as possible, because we know that early intervention has a huge impact on how these children do long term. So what happens beyond the NICU, these services are very, very important in modifying outcomes after brain injury, because it all comes back to, outcomes are not fixed. And our goal is to promote brain health and allow every child to reach their full potential. So that's where early intervention plays such an important role.
So important. I think the CP, cerebral palsy comment that you brought up, it does take a while to diagnose CP because I remember Claire's early intervention physical therapist. Claire was 18 months old before she told us that she did not have CP. And before she kind of evaluated her over the many months of us working with her through early intervention, and also it can be diagnosed at different times, right?
Yeah, so that's a great point. I think in the past, generally, we did not make a diagnosis of cerebral palsy in babies when they were very young, but we do have, growing evidence to suggest that it's really important for us to make a diagnosis early because early interventions matter and they make a difference. And so, this is a really nice province-wide screening program that was actually developed by the developmental pediatricians here in British Columbia. And it's one where they screen province-wide any infant who's at increased risk for cerebral palsy to make a diagnosis of cerebral palsy as early as possible. So the goal is under the age of 1, even earlier is better,
Mm-hmm.
so that we can make early referral to therapists, to physiotherapists, occupational therapists, and start early interventions early. So yeah, this is one area where I think more and more programs are now moving towards early diagnosis of cerebral palsy to try to really promote that brain plasticity and provide interventions when the brain is still growing and developing.
That's wonderful. The earlier the better. We talk so much to families when you're out of the NICU, just get in touch with the early intervention services, make the phone call, get the evaluation set up, just how important that is. And kids go in and out. These babies can go in and out of early intervention where we are. Claire was in early intervention. She did well. She graduated. I saw some things I didn't like. They came back out. She got some different services up until through 3 years old here. And it was a game changer for us. I mean, I credit her therapist with why Claire walked when she did, because we worked so hard and so many simple things that you wouldn't think about, but go, oh yeah, that makes sense. That helps a baby stand up. That helps, a baby take their first steps. So little things that are so important. Speaking of families, I did want to ask you, you've watched these babies, you see them in the NICU, see them post NICU. Is there a moment or a family story that has really stuck out to you, something that you carry with you and has taught you a lesson over the years?
Yeah, I think I would say it's actually family stories that are very similar to yours. Families who, there's brain injury, you're told, I think you mentioned you were told, she would have difficulties with walking, with talking, and now she's this young person who's singing, who is doing just so well. I think it's stories like yours that have been, a big lesson. And it's what has told us that really the baby brain is resilient. And that, once again, it comes back to this idea that outcomes after brain injury are not fixed. And I think it's really highlighted the importance of having hope, and that the goal for us is to support every child to reach their full potential. So I would say it's family stories that are very similar to yours that have been the ones that really stick with you.
Love that. And final question for you. You've worked with a lot of families. What's the biggest piece of advice you give them?
Oh, I would say the biggest piece of advice is to ask questions. There's definitely, like, I understand there's definitely a power imbalance, and some families can feel, hesitant to ask questions. They're worried about either upsetting us or taking up too much of our time. But this is so important because it's your baby. And our job is to make sure that you are well supported so that your baby and you and your family do well. And so this is something that we actively encourage in the NICU. Ask as many questions as you can, actively get involved in therapy and providing care both in the NICU and at home. And it's something in terms of advice, I guess, to families, that would be the one thing that I would encourage every family to do. Just ask questions, as many questions as you can. Nothing is a silly question. If it comes to mind, write it down and ask your neurologist or your pediatrician when you see them.
Great advice. Ask questions. Be a part of the care team. It's so, So important. Dr. Thiviya Selvanathan, thank you so much for being a part of the NICU Today podcast today. Thanks for sharing about the important research that you're doing. Very grateful that you joined us.
I'm so grateful that you invited me. It's been wonderful having this chat, and thank you so much for inviting me.
Yes, and to our listeners tuning in today, we look forward to having you join us on the next episode. Thank you. Thank you for tuning in to the NICU Today podcast, brought to you by Today is a Good Day. Learn more at todayisagooddday.org.